myself Dr Ishita Mukerji and I'm a senior psychologist with Kaleidoscope, which is a mental wellness center. And today I'm here to simplify the difference between mental health and mental illness. As you might hear these terms quite often these days, and you might be wondering and seeking answers for questions like, what is the difference between the two? Is feeling sad or unhappy a sign of mental illness? Well, everyone has mental health just as everyone has physical health. And throughout our life, it is likely that you will feel your mental health is better at some times than others, just like physical health. Also, mental health and mental illnesses are increasingly being used as if they mean the same thing, but they do not. As the WHO famously says, that there is no health without mental health. So in the course of a lifetime, not all people will experience a mental illness, but everyone will struggle or have a challenge with their mental well-being, just like we all have challenges with our physical well-being from time to time. So it's very important to know how to maintain your mental health, as many people with poor mental health or mental illnesses may not seek help or do not even understand what help is available. So let us understand, what is mental health after all? Well, mental health or mental well-being relates to our emotions, thoughts and feelings, our ability to meet and overcome problems to achieve our goals, or accept our strengths and weaknesses, set realistic goals, or to make social connections and have a meaningful life. Whereas poor mental health may result in feeling unhappy, difficulty thinking clearly, or feeling overwhelmed by stressful situations. As we all have days when we feel stressed or overwhelmed by events in our life, good mental health is the ability to look at problems realistically and address our concerns in a more positive way. Well, mental illness affects a person's ability to function over a long period of time, and it is not the same as feeling sad, unhappy, or stressed. Whereas people with mental illness may feel distressed regularly and may not feel in control of their lives, and it affects how a person thinks, feels, behaves, and interacts with other people. And this can range from anxiety or depression to personality disorder, addictive behaviors, etc. Well, these illnesses are a result of biological, developmental, or social factors and can be managed with psychological therapies, psychosocial support, and medically in the same manner as a physical disease would be treated. And it can affect anybody, no matter their lifestyle or circumstances. So it's important for people to reach out if they feel they may be experiencing mental illness. Well, just remember a few points in case you or anyone around you has symptoms of mental illness. Talk regularly about your mental health with your friends or those you trust. Talking about your emotions comfortably will help those around you identify when they see a change in you. Let's break the stigma associated with people who experience mental illness and keep the conversation going. Educate yourself and your family on mental health and mental illness is the ideal place to start. And with the right treatment, people can recover from mental illness. And friends and family members can be important influences to help someone get the treatment. For many people, the first step is to recognize there is a problem and be willing to accept help. And because of the shame and blame sometimes associated with mental illness and mental health, many people feel like they can't reach out for help. So let's make it easier for those suffering from this particular disease. Myth number 1. Mental illness is incurable and lifelong. Well, the fact is, with the right kind of help, treated appropriately and early, most people recover fully and have no further episodes of illness. Myth number 2. People are born with a mental illness. Well, the fact is, people develop mental illnesses with no family history. Many factors contribute to the onset of a mental illness or a mental problem. This may include stress, relationship breakdown, unemployment, social isolation, a major physical illnesses, etc. Myth number 3. People with mental health issues are violent or dangerous. Well, the fact is, a large majority of mentally ill people are not violent. Only about 7% of violent acts are committed by a person with symptoms of mental illness. Myth number 4. Mental health problems are a sign of weaknesses. Well, the fact is, mental illness has nothing to do with strength or weaknesses. It is a medical disorder that needs treatment. If you need help with a mental issue, you're not weak. Myth number 5. therapy is a waste of time. Well, the fact is that their therapy actually focuses on solutions and problems, and research has shown that it is a very effective in treating medical or mental illnesses. Number 6 myth is having a mental illness means you are crazy. Well, the fact is, so having a mental illness means having a challenging symptom like any other physical ailment. While concluding, I would like to emphasize the fact that mental well-being needs to be an integral part of our lives, and we must consider it as much important as we give it to our physical health. Hope you all stay mentally healthy and live your each day to its fullest. Thank you very much.